This particular place, it's good they give out supplies for harm reduction, but it's more of a harm enabler.
Safe consumption sites. There was one when we came into office in 2015. Now there are dozens and dozens and dozens across the country, and they are saving lives significantly.
I would rather not do it, first of all, because it's just destroying the out of my life.
Safe consumption as well, making sure there's a safer supply so people who are addicted can get clean drug supplies as opposed to having to buy the dirty and deadly stuff that is all too often on the street.
They want us stuck in the cycle. I'm out here on the streets and it's because I'm stuck in a cycle.
No, you need drug treatment programs. That takes money from the government.
Back the up, bro. I swear to God, I'll blind you, bro.
Yo, get back. Lincoln J reporting for Rebel News in Toronto. Now today I'm going to give you a little taste of what it's like in Justin Trudeau's Canada in 2023. Recently I visited a Toronto public health location in downtown Toronto at 277 Victoria Street. This facility is located just steps away from one of the most popular attractions in Toronto, Yonge and Dundas Square, and it is right next to Toronto Metropolitan University, formerly known as Ryerson. Now, as you're about to see in a minute, literally anybody can walk into this facility and they can walk out with brand new free drug paraphernalia. This isn't exactly a secret, it's public knowledge on the City of Toronto's website. There's a list of drug paraphernalia that you can get for free of charge, including needles and syringes in various sizes and brands. This location is also a safe injection site where people can use pre-obtained drugs under staff supervision. Before we go any further, guys, please visit our website at helpnotharm.ca. You can sign the petition on that website if you think that the federal government needs to rethink its stance on drugs and provide people with the help that they truly need. Let's just cut to the chase. I'm going to show you guys how easy it is to obtain these items. Let's check it out. I just need to get some supplies. Yeah. A cooker, some syringes.
Do you need longs or shorts?
Can I get both?
Sure.
Is that...
You want a kit of each?
Yeah, can you just get me whatever? Like, thank you.
Yeah.
Excuse me?
So the kits have everything in it.
Okay.
We have everything that you want.
This is it?
Yep.
Okay. If I have friends too, like, do they have to be a certain age to come here?
No.
So, like, if they're 15, 16, that's okay? All right, thanks guys. As you just saw, my producer and I were supplied with pipes and syringes in just a few minutes time. If you ever walk by this location, you will almost always see groups of people hanging around outside, some using drugs right in the open outside of the facility. We were able to interview a handful of people that were hanging around outside of the facility and just get their opinions on the matter. This is what they had to say.
Well, sadly, I'm addicted to drugs. I come here to purchase my drugs, to get drugs for free. Before last year, I used to steal a lot for drugs, and I'm super ashamed for it. It put me in jail for 3 months, and I deeply regret it, but I still do drugs till this day. The city does not provide drugs for us, but what they do provide is alternatives like Suboxone, methadone, and different medications to get people off of drugs.
So I use intravenous. You have to blur it out, but it's like that, it gives you an idea.
Do you think it's a good thing that they hand out these items? Pipes, cookers, syringes? Do you think it's helping things? Do you think it's making things worse? What are your thoughts on it?
That's a tricky question. That is a tricky question. Honestly, it's a good thing because you can't get them anywhere else in any other city like so easily. So it's a very good thing. What I think is that it's a horrible idea that they put it beside a university.
This particular place, it's good they give out supplies for harm reduction, but the way it's used by a lot of people, it's more of a harm enabler.
We will continue to work on a harm reduction approach. We will continue to work with frontline partners. I think it's a great program. I mean, along with the safe injection sites.
I would rather not do it, first of all, because it's just destroying the out of my life. And secondly, because if it wasn't there to begin with, I wouldn't have a way to do it.
This place gives paraphernalia, but it wouldn't stop them from doing a drug. Because if they didn't get the paraphernalia from here, they just get a piece of tinfoil, do that way.
You're saying it's making the problem worse?
I believe so, yeah. Just like, for example, they also have you noticed you go into a bathroom stall, but have you noticed the syringe case? As soon as I go into the bathroom, especially since I use intravenously, when I haven't been thinking about it all goddamn day because I'm outside doing things throughout my day, as soon as I go into the bathroom, oh now I need drugs.
Have you seen anyone die out here?
Yes. I died many times here.
I've seen about 3-4 deaths.
Here?
Yeah.
You've seen 3-4 deaths here outside this facility.
And
overdoses or?
Overdoses, mostly fentanyl.
The evidence is clear. Harm reduction measures save lives.
I did witness a lot of overdoses, yes. And it's not pretty. It's not a good thing to witness.
There was just recently a stabbing here where someone died, and also at Sanctuary where someone died.
I've seen a lot of crazy here, but what I've seen with most is people coming here just doing drugs to themselves, not sharing with anyone who wants, and boom, they overdose. And people just rob them.
Is there anybody out here offering you help to get off the streets, or are they just helping you basically with the drug use? Like, is there anybody trying to get you in any programs, anything like that? Can you talk about that?
I mean, that's what they were trying to do here at one point. Like I said, it was, the entire building was supposed to be devoted to that, and they're still working hard to get a lot of the funding back. Obviously the Streets to Homes, but that's another independent agency.
Yeah.
And I find that, at one point there was, Streets to Homes teams all day long. Like, you would see them no matter where you were. And like now, I mean, I was just recently incarcerated, and I've been back for about a month and a half, and I've run into one Streets to Homes team, and all they did was make an appointment for another team to come back and see me later.
I haven't been offered anything yet. They said phone central, or they seem to be piggybacking, go here, go there. They seem to be trying to go somewhere else.
How it works here is you kind of have to get their attention for them to give you attention, because they're just here helping people, but they're not gonna just reach out to you if they see you on the corner doing drugs. Like, they want to see you kind of come to them and ask them for the resources.
One, disgusting to me from my point of view, and two, astounding just how little our government actually gives a flying about us. But how little the community, who does care, we do see it, actually realizes just how much we're going through and how hard they're making it for us to get out of this. They want us stuck in this cycle.
There's 365,000 homeless, and you got people like Justin giving billions to Ukraine and 12 million to Haiti, which make a lot of housing for people.
I'm still out on the streets, and it's not because I want to be. I'll tell you that much.
As we were wrapping up those particular interviews, a staff member of the Toronto Public Health Facility obviously noticed us filming, talking to people, and didn't like us being there at all. I mean, just check out this interaction. Syringes.
Neither of your family members ever need a place like this. You are despicable.
They're talking to us.
Despicable.
Do you work for the clinic,
You are despicable.
Why is that exactly?
This is
Despicable.
Why?
You are so despicable, and you do not have my permission to film me. You do not have my permission to record me. You do not have permission. Get me off your camera now. Get me off. Get me off your camera now. You have no right to do this.
They're talking. They're talking. He's talking to us.
Back the I swear to God, I'll blind you, bro.
Yo. Our intent being there was just to get a better understanding on the services provided and to actually speak with some people who use the services provided. We just walked into that facility, walk out with a crack pipe, syringes, Do you think it's helping drug addicts? Do you think it's making things worse? What's your opinion on it?
I think it's actually making things very worse, because if they have accessibility to the instruments that they need to take the drugs and whatnot, they're going to continue. So it's not going to change anything. It's definitely going to be worse.
I think it's a safe way. I think it's like kind of like a twofold thing. It's like good or bad for both situations. It's like as she said, I also support the safe injections, but again, it's in a really bad area to create it because of the school and the area itself. It just has become increasingly dangerous in this area, and it's scary for students, especially females, at night to walk through this area.
He's seen outside of the Yonge and Dundas Square location today, where Ryerson University security were seen trying to disperse the crowds.
I think it's great. You need safe injection sites because I work downtown. I'm a super at one of these condos down here, so I get to pick up the needles and stuff. Much better to pick up those than it is to pick up there's other crap that,
I mean, I totally support like safe injection sites. However, it's the location of it that is so close to the university. It makes it very uncomfortable for the students. Like, we're students ourselves, we go there. So having to walk through it all the time and kind of being scared a lot of the time, it's not super fun. So
you walking around the streets of Toronto, do you notice a difference? Do you think things have gotten worse? Do you see more people openly using drugs?
It's actually worse. Yeah, when actually was, definitely worse. And it will get even more worse.
I feel like the government needs to do more than just giving safe injection sites. Especially after COVID, I feel like a lot has raised, a lot of homelessness, population, a lot of drug use, and it's scary to walk around this town. Like, and you literally everywhere you go, you're gonna see someone with drug abuse or something like that.
Yeah.
Do you see it getting worse? Like, do you see a lot more people openly using?
Yes, 100%, especially in this area right here, right in front of the safe usage site. I see a lot of both drug dealers and drug users, which is kind of scary.
Since moving to Toronto, I actually have seen people shooting up, which I never saw before. I've become desensitized to it.
Do you think the problem is getting worse in Toronto with drugs, or is it getting better because of programs like this?
These programs are just a stopgap to keep people from dying. Like, I came by yesterday, day before, two guys had OD'd on the street, but they had naloxone kits. People right there were taking care of them, right? So, no, you need drug treatment programs. That takes money from the government.
Yeah, absolutely. We went on a trip down to Prince Edward County just for the weekend, and it was so nice. And then within 5 minutes of us being back, somebody was knocking on our car window with their pants around their ankles, like asking us for money, like holding a crack pipe in one hand. So it's just, it's so common here.
Yeah.
And although there is like safety in numbers where you feel like, I don't know, it's kind of like an even balance, that shouldn't be how it is, where it's completely equal.
Now that we have a little taste of the public's opinion, let's look at the hard facts on the matter. Toronto Paramedic Service and Toronto Public Health have been keeping track of the amount of suspected fatal and non-fatal overdoses. Now, when we're looking at suspected fatal overdoses in 2018, the number is 146. In 2022, that number jumped up to 272. This is an 86% increase in suspected fatal overdoses. Despite this massive increase, Prime Minister Justin Trudeau continues to double down on his stance that safe injection sites and handing out free drug paraphernalia is the way to combat drug addiction.
We're using every tool at our disposal to work with our partners to end this national public health crisis. Since 2017, we've committed to more than $1 billion to address the overdose crisis, and we're taking concrete steps to divert people who use drugs away from the criminal justice system. The evidence is clear. Harm reduction measures save lives. Some 46,000 overdoses have been reversed since 2017. We will continue to trust the science.
When we look at alternative options for treating addicts, we can look to the province of Alberta. Alberta Premier Daniel Smith announced on May 15th an addiction treatment action plan.
That Alberta's addiction treatment system now provides detox treatment and recovery services for up to 29,000 Albertans every year, fully funded and free of charge. While our drive to build a world-class addiction care system is recognized around the world, it's being called the Alberta model, we're nowhere near done. We must assertively drive forward with these plans. And that's why a re-elected United Conservative government will build over 700 new publicly funded addiction treatment beds across Alberta with 11 new treatment centres. We call these centres recovery communities with free admission to any Albertan who needs it. The first of these recovery communities opens this week.
Instead of using tax dollars on keeping people in the continuous cycle of addiction, we should be shifting the focus on getting these people out of this cycle and off the hard drugs. If you want to check out more content on this topic, you can visit our website, helpnotharm.ca. Through that website, you can sign our petition, and together we can send a message to the people in power. Thank you so much for watching, guys. Thanks so much for watching, guys. Once again, that website is helpnotharm.ca. Sign the petition if you think the federal government needs to rethink its stance on drugs.